welcome, as I said, welcome everybody. Thank you so much for joining us for this webinar for health visitors. We've kind of thought we put on an extra webinar for you guys because there's such a lot of information, and we're updating our. Oh, hold on a minute. I've done something funny. Oh, hang on. Okay, we update our information all the time, and we talk to our members all the time, and we're getting more and more lived experience, and we're altering and adding to the information that you already have. Also, so hopefully you might get a bit more of extra information from today. So if you don't know me already, I'm the training manager for Down Syndrome UK and Positive About Down Syndrome, which is our kind of healthcare arm of Down Syndrome Down Syndrome UK. We're a national charity that's been running nearly 9 years now, and we work together with all sorts of healthcare professionals, and we've done quite a lot of research, and we also are involved in lobbying change makers and trying to get involved in policy, really. So our vision is very simple, which is a world where everyone with Down syndrome lives their best life. And just to show you that we are a credible organisation, we do little surveys every year. This is the results of last year's survey, to show you that families do go to us for Down syndrome advice. They trust the information we're giving them, and they find us very, very supportive. So that's good to know. So our main role is really that we champion the lived experience. I think in a lot of professions that you come across your families and away they go, and you don't actually know how that experience was for them, the good bits and the bits that didn't agree with them. So we champion the lived experience by talking to our membership, and by doing that we can educate professionals, we can affect change, enlighten the public, but also empowering parents and caregivers that their voices are being heard, and they're part of a community that listens. So we're a parent-led charity, and as such we consider ourselves to be experts through experience, and we understand the importance of receiving relevant information, meaningful support, and we want to make sure that everybody through any kind of healthcare appointments, that every family who has a child with Down syndrome is not subjected to any out-of-date attitudes or language, but also that the people that are seeing them are up to date in the knowledge, and they're signposting for support. So we found with research that we constantly do, actually, that when families are given the news that their baby has Down syndrome, they're telling us that they're getting, little support and not much information. And often this might be at the time when they're making decisions whether they want to continue that pregnancy or not. But it's not just in maternity care. We also looked into breastfeeding. Constipation obviously is quite common in our children, as is nystagmus. And we found that there is a lack of support and knowledge surrounding a lot of healthcare conditions. And we've also done a lot of research into maternal mental health, and we found that postnatally, women are telling us that they feel that their mental health is not fully supported, and that goes down postnatally. It's not a lot to start with, and then it goes down postnatally. And we found that sometimes the attitudes of healthcare professionals surrounding Down syndrome may have a negative effect on their mental health. But do take a look at our recently published data on this. So going on to parents, what do they worry about when they're given the news that the baby has Down syndrome? These are really common reactions. They don't want their other children to be burdened. And what about the impact on their family that they already have? And if you've been to any of our webinars or any of our training before, you'll know that statistically, siblings of children with Down syndrome are not adversely affected by having a sibling with Down syndrome. In fact, a lot of them go into caring professions, so that's a positive there. Another common thing that parents worry about is that they'll never fit in, they will live with us forever. And hopefully that really isn't the norm these days, that people with Down syndrome want the same as everybody else. They want that independent life. They want to live with their boyfriends, girlfriends, husbands, wives, friends, and also they want paid work, and they want that independence. And I have to say, the generation of people, young people with Down syndrome that I know, they are striving to get that independence. They don't want parents interfering. They don't want support workers interfering. So times definitely are changing there. Another thing that parents worry about is, will they be able to cope with the extra pressures of having a disabled child? And statistically, we found, this is not our research, but it is published research, that there are some really good positives of being a parent of a child with Down syndrome, growing as a person, becoming more determined to face up to challenges. And certainly as a parent myself, I feel like I've experienced all of those, having had my son, since having my son with Down syndrome. Sorry, I'm rushing through this bit so that we can get onto the support and the signposting for you. So as you know, times are changing for people with Down syndrome. They're now living longer. Their life expectancy now for someone with Down syndrome is 60 plus generally, and they're living more fulfilling lives. And obviously, improvements in the healthcare and education that they're getting, the support and opportunities, gives them a role in the community, gives them an improvement of a quality of life, and that has a knock-on effect on life expectancy. In terms of paid work, that's something we're definitely trying to improve, because you probably know something like 6 to 7% of people with learning disabilities get paid work, and that's a massive disparity there. So as a healthcare professional, how can you ensure that parents receive better care and support? So as you probably know, as long as you've got a contemporary understanding of what Down syndrome is like in the 21st century, that's the first thing that you can do. And I'm sure you already have that. If you've got that positive outlook that parents are telling us that they're not always finding with their healthcare professionals that they come across, you will lessen that family stress and vastly improve their mental health. It's extremely simple, that first bit. Make sure that you have a contemporary understanding, and because parents will look to you for information and support. So don't limit what you think people with Down syndrome can achieve, because if you have an outdated attitude and have those outdated assumptions of what people with Down syndrome can achieve, that comes hand in hand with an unconscious negative bias. Person first language is really important for our community, as you probably know, that when you come across a family of a child with Down syndrome, don't go in there with Down's babies, Down's kids, and putting Down syndrome before the child, because as a community we find that dehumanizes our children. And if you're going to talk about Down's babies, you're getting on the wrong side of that family right from the start. So person first language is so important when it comes to Down syndrome, so important. So in terms of health visitors, we've been working with the Institute of Health Visiting, and we have done a little survey for our parents to give us feedback as to how their health visiting experience was. And this is what I'm going to be sharing with you today. This is kind of best practice. First of all, don't be sorry. A lot of parents are still telling us that their initial reaction of a lot of healthcare professionals is, "Oh, I'm so sorry that your baby has Down syndrome." And I'm hoping that you find that difficult to believe, because nobody should be sorry, but women are still telling us that they're getting that, "Oh, I'm so sorry that your baby has Down syndrome." Think about your language. Don't constantly refer to Down syndrome, because they know their baby has Down syndrome. Once you've mentioned it once, I don't think you need to keep referring to the fact their baby has Down syndrome. As I've already mentioned, make sure that you've got a contemporary understanding of what life with Down syndrome is like. And if you need any help with that, do have a look at our website, or do email me, and I can answer any questions that you may have. Don't assume that parents know a lot about Down syndrome. Some may not. Certainly when I had my son Billy, I didn't know anything about Down syndrome, and now I consider myself a bit of an expert. But I didn't know anything about Down syndrome. I didn't know anyone with Down syndrome. I have to say, I'd met somebody with Down syndrome way back in my childhood, and they scared me, to be honest, back I don't know, 40 years ago, quite a long time ago, more than that. So the saying having a contemporary understanding of Down syndrome, a lot of the families that you come across may not have that contemporary understanding, and that may scare them quite a lot. So don't assume that they know a lot about Down syndrome. Just perhaps even if they've just had that antenatal diagnosis, they still may not know a lot about Down syndrome. They may have been not purposefully not ready, not being able to look into information about Down syndrome at that time. So help them along their journey by having high expectations for their children with Down syndrome. Don't, the default state should be high expectations. Don't assume that they won't be able to do things, that they won't be able to reach their milestones. We have to assume that, that they will in their own time. I know some children with Down syndrome may not reach those milestones, but it shouldn't be the default that you assume that they can't. See the individual and don't generalize. As parents, we get a lot of head tilts. They're always loving, and aren't they? They're always happy. And there's a Downs person that works in Asda, and that does still happen quite frequently. Don't generalize or say, my cousin's got a daughter with Down syndrome, unless you have a child with Down syndrome yourself, or you have someone in your immediate family and you want to share that positive experience, then sure, that's fine. But distant people, or people you've seen on the street, or people you've seen in the shops, it's don't generalize. That's what our lived experience from talking to our membership is telling us. So be aware of diagnostic overshadowing. What would be considered if they didn't have Down syndrome? We find that a lot of healthcare professionals are saying, oh, that's because they have Down syndrome. They're constipated because they have Down syndrome. Yes, they probably are constipated because they have Down syndrome, but that shouldn't be the end of the conversation. They should be treated, as anyone else. Also, we find that parents are being told that their baby can't breastfeed because they have Down syndrome, rather than the fact that they actually have a tongue tie. Things like that. Be wary of, what would be done if they didn't have Down syndrome, and ensure it's the same as anybody else. So best practice, what we consider that you need to know is to make sure that you use the correct growth chart when you're doing your weighing and measuring, because there's a separate one, I'm sure you know this, for children with Down syndrome, just to make sure that you know how they're developing in that respect. Signpost families to their local Down syndrome support group. Make sure you know if your area has a Down syndrome support group. We have all this on our website. Establish if there's a Down syndrome pathway in your area. Some places do have a Down syndrome pathway, and hopefully, if that is in your area, I'm sure you know that that's there. Ensure children access the services they need. Our little orange book of knowledge, which I'll show you a picture of in a moment, has all that information in there for families, and it can be accessed online. It gives a lot of information that families need, like how often should they see their pediatrician. Some people feel they don't see their pediatrician as much as the standard guidelines. Occupational therapists, when should they be referred? Why do they need one? Speech and language, the same. Teeth, I find really good. In that little orange book of knowledge, when I had my son, nobody told me that his teeth would take a long time to come. They take over a year generally, and they come randomly. And I was really panicking that there was something wrong with him, that he wouldn't have any teeth. So it reassures your families, and it gives them an idea of what professionals they need to see and when. Be their advocate. Parents may feel overwhelmed, emotional, and under-supported, and we want you to be the person, or people, but healthcare professionals that they come across, to be a person who fights their corner, help advocate for their child as they battle their systems. I've put that in because we don't always have to battle the systems, but generally there are quite a lot of systems to battle, and it can grind your families down, and to have supporters would make a real difference to them. In terms of developmental checks that you have to carry out, it's a tricky one, I know, because some families will say, yeah, they really like the developmental checks and it was really useful to them, especially if they're applying for DLA. It was useful for them to know what developmental milestones they weren't achieving at that age and how far off they were. But for others, They find the developmental checks really distressing, and it reminds them of what their child can't do at that point of their development. And especially if they have other children, it reminds them that their child is not neurotypical. So I think the advice would be just to ask them, how do they feel about that, and if you're able to do that not as an appointment that the parents are there and you're ticking off and talking about the things that they can't achieve, if you could do that in another way without pointing out how developmentally where their children are, if those parents don't find that useful or might be upset by that at that time. But let's have a discussion about that afterwards. It'd be really useful for us to know your point of view on that as well, actually. So in terms of how, as an organisation, we're able to support your families, we have a whole load of closed Facebook groups that they're welcome to join. We have a Great Expectations one for women. We have a dad's one as well, who've had a antenatal high chance result or a diagnostic result of Down syndrome, and they can join that to discuss any kind of issues and worries that they have, which is doing very well. We get very good feedback from that group. And once the baby's born, or if they've had a postnatal diagnosis, they can go onto a new parents group, going onto a preschool parents group. Obviously, the support and advice that they get are different for, according to the age of their child. And we now go into primary school because we've been going nearly 9 years now. So we have a primary school group, and we're hoping to branch into secondary school as well. So we're hoping that there's advice available for parents for all aspects of bringing up a child with Down syndrome. So I've already mentioned the Little Orange Book of Knowledge, which is this. We have hard copies, which often local support groups will buy, but parents can access that online. So do signpost your families to them. The Nobody Told Me book, hopefully your parents will be aware of this, because if they've joined any of our Facebook groups, they get given one of these. But again, they may get it from their local support group, but it's available online. We called it the Nobody Told Me the Truth About Down syndrome because there are a lot of myths still surrounding having a child with Down syndrome or having Down syndrome. And in that book, it covers lots of aspects, not just the parental aspects, but also we've got grandparents, we've got friends of people with Down syndrome, people who work with people with Down syndrome, siblings, and most importantly, the aspirations of people with Down syndrome themselves. So in terms of lived experience, we have our heart surgery experiences. I'll talk about our Heart Buddy scheme in a moment, but both breastfeeding and heart surgery, we found that there is a real lack of information and support for parents. So we have produced these so that parents get an idea of what to expect if their baby needs heart surgery or if they're struggling with breastfeeding when they want to breastfeed. So Heart Buddies is a scheme that we developed to support those families. So we pair up families of children that are about to have a particular heart surgery because there are 4 main heart defects that our children have or may have. So we pair up a family that's had that actual heart surgery at that actual hospital with a family that's already gone through that surgery and at that hospital, so they get that emotional support but also the practical support of where do they park their car, what's the hospital accommodation like, what should they do, where should they go when their baby's having their heart surgery, what is their baby going to look like when they've had their heart surgery. All of that support, which has become quite invaluable for families at an extremely stressful situation, we now hopefully have alleviated a lot of that stress for families. The same goes for breastfeeding. We found through our research and questionnaires that a lot of people are being told that their baby cannot breastfeed because they have Down syndrome. It may take longer. We have some really good advice from Sarah Ojar, who's our breastfeeding coordinator, who's produced a book. So we have those resources available to your families that she's able to give handy hints of how best to breastfeed your baby. But she also does meetings and like a boot camp type thing where the mothers can talk about the issues that they've got, and hopefully she'll be able to help resolve any issues they have. So we've done 2 breastfeeding surveys. This one in 2022 was our the one that was published, but we've had one since then. There still is an assumption that babies with Down syndrome can't breastfeed, and parents are telling us there's a lack of knowledge and support surrounding that. And we've got a paper published about NG tube support for babies with Down syndrome, which is just been published, I think. Do get in contact if that's something that you want, if you're interested in. And I think we'll be launching information about that soon, actually. So pants for school, another area where parents were telling us there was no information or support available to them is around toilet training. And certainly my son's now 15, and when he was younger, I was told not to bother to toilet train him until he was older, like 5 or 6 or 7, because he wouldn't understand. And that information wasn't just for me, 15 years ago, 10, 15 years ago. We found that a lot of families were still being told this. So we have joined together with the charity Bladder and Bowel UK, and we have a resident expert, June Rogers, and we've developed a scheme called Pants for School, which is what it says on the tin, to get our children with Down syndrome in pants ready for school. We also have a designated coordinator for this, and June Rogers does a potty training boot camp, where if you sign up for the Pants for School program, you can join a boot camp. I think it's every week, is it? I think maybe Tracy Bielsa, every week or every month, where they can talk about the issues that they're having with it must be every week, mustn't it? That they're having with their toilet training, so they can talk with other parents that are on this journey, but also with the professionals to get advice. So our Pants for School scheme has been very successful. It's not to delay them with the toilet training, it's to start them really early. It's the opposite. It's to start them as soon as they can sit, really, making them aware of a potty and what it's there for. And we're finding that if parents are following this scheme, starting them early on the Pants for School program, that a lot of them are now being toilet trained alongside their mainstream peers. And people are telling us that it's a lifeline, and I can well believe that, having been. Sorry.
Oh, hi Rebecca, thanks for calling me back. How are you?
Oh, we need them on mute. Yeah. I don't know who that is.
I don't know if you got my very long-winded voicemail. I was more.
Okay, excellent. So people are saying that it's a lifeline, and it is making a difference. Again, it's for those children that are going into school, being seen as any other child. They're not the one that's in pull-ups, and it's having a massive difference, really. So we're really proud of our Pants for School scheme. So also that we're able to provide more specialist support that perhaps not all families may come across these kind of health conditions. Hirschsprung's, again, there was nowhere where families were going if their child had Down syndrome and Hirschsprung's, and where to get advice for that. I've already mentioned the NG tube feeding. A lot of children with Down syndrome are given NG tubes when they're born, and there wasn't any support or advice that families were able to access. Infantile spasms, we have a resident expert on that, and constipation, that's all tied in with our Pants for School. But we have a load of resources. Do have a look at our website, because we're changing it all the time and updating it all the time. Nystagmus, I've already mentioned, is a common condition in children with Down syndrome. That's actually my son there who has nystagmus, and I was given no information about it. The only time I knew that it was a visual impairment is when I was a visual impairment teacher rang me and made an appointment, because I wasn't aware of how that would affect him. So there wasn't a lot of information surrounding nystagmus, but now we have Dr. Maggie Woodhouse, who's a Down syndrome visual expert. She's recently retired, actually, but we still have her expertise on hand. But a lot of parents were hoofing it over to Cardiff, wherever they were living, to go and see Maggie. But now we've got a lot of her information and support online, which is making a massive difference to families. So I think I mentioned early development groups early on, when it comes to the fact that people with Down syndrome are leading now more fulfilling lives. It is down to a lot of early education, access to early intervention and education, really. So a lot of these early intervention groups, they're not really available on the NHS. They're generally available from local charities, and if your family doesn't have that local charity close by, or they're not able to join a local charity, or they don't want to join a local charity, then where are these families getting these early interventions from? So we now have our physiotherapy, online physiotherapy sessions, but also our early development groups that are now online. Physio, I think a lot of families are being discharged from physio quite early on, are not able to access physio in those early, months and years. So we have a really good physio who's a parent of a child with Down syndrome, who has some really good specialist knowledge that your families can access online. And our early development groups cover like fine motor skills, speech and language skills, memory skills, literacy and numeracy, and they're all available online. So how else do we support families? Disability living allowance forms are really tricky for our families. A lot of families don't know that they need it, or they're entitled to it, and the form is really demoralizing and difficult to navigate. So we now have drop-in sessions for families to help fill in their DLA forms at whatever point they need to fill that in, as well as EHCP support service. Again, these things kind of differ in different areas of the UK, and a lot of families don't know where to get support, or will a lot of them accept the results that they get. So they may have filled in their DLA form without any support and got that they're not entitled to DLA. But if they got advice and filled in the form, correctly, in a way, that explains what their child's needs are, then, we're making sure that there's more of a level playing field when it comes to supporting our families. The same goes for EHCPs. EHCP support differs in each region, and we provide a support service in terms of EHCPs, and we have a resident expert who can check every EHCP and see what's missing and what things that you can be improved to make sure that, because obviously EHCPs are a legal document, to make sure that their child legally is getting everything that they need to reach their full educational potential in school, really. So on to education. We have a load of resources about choosing a nursery, because obviously a child with Down syndrome has developmental and educational needs, and a lot of families feel, at sea in terms of what should they be looking for when it comes to nursery and school provision. So we have guides there for families choosing a primary school, choosing a nursery, advice for professionals working in primary schools, and we have a handover sheet which is really helpful. A lot of healthcare education professionals have said that they found that really, really useful. So we have a load of resources. Again, we change that all the time, and these kind of things for parents to take into their nursery or their school. We've got resources to introduce places to their children, so they have more of an understanding of what their child individually likes and needs. And I think that's helping parents as well as educational settings into how best to support them. So do look at on our website if you're interested in that, or make sure you're signposting your families that are coming up to nursery age or school age what we're able to offer. We're really pleased that we have Dr. Becky Baxter on board. She's been with us a couple of years now as our Director of Education and Speech and Language Therapy. She's got years of Down syndrome specific experience in speech and language therapy and education, because research is telling us there's been a lot of research into the way people with Down syndrome learn since the 1980s, but current research is telling us that our children have specific learning profiles and they have a speech and language disorder, not a simple delay. So what we're looking at is specific Down syndrome specific education programs for our children, and specific Down syndrome specific support for our children, as well as speech and language therapists that are aware of the I keep saying specific, I'm annoying myself here, specific Down syndrome speech and language disorder. Otherwise, they're not getting the speech and language support they really need unless it is Down syndrome specific. So she's, promoting early speech sounds. she has programs for that, and Down syndrome specific education support that we've just recently developed and promoting, which is early years program and a primary education program. I'm just going to tell you a bit more about this so that you can best signpost your families. So with our early years program and our primary education program package, we have a package of information and guidance of ongoing support, as well as drop-in sessions for professionals. So they also have access to specialist expert advice and resources from Becky. They have access to live and pre-recorded information sessions from Becky, a video guidance and activities, and promoting positive behaviour, I think, is a massive thing for families and educational settings. Because as a condition, Down syndrome is not generally associated with behaviours, and it's generally to do with the lack of speech. But Becky has a load of resources helping professionals understand their profile, as well as developing an effective behaviour plan. You're able to submit that to Becky and then have a discussion about how to improve behaviour of particular children that they have in their schools. It's a really good system that hasn't been done before, and it is helping children reach their full potential in education with Down syndrome. A load of information sheets for primary schools in terms of educating their child with Down syndrome, and it's all broken down for them. Again, none of this has been done previously, all in one area, and we're hoping it's going to make a real big difference to children in schools. So as an organisation, we have a load of information sharing sessions for parents and professionals. I mean, I've already mentioned a few of them. Makaton signing, our children are visual learners, and it's really so useful for professionals to know Makaton, but also healthcare professionals and educational professionals, especially in education. If Makaton is their primary way of communicating, if staff don't know Makaton, then how are they communicating with these children? Choosing a nursery, EHCPs, positive behaviour, dysphagia is a common condition that our children have. We have information sharing sessions on that with resident experts in infantile spasms. I've already mentioned social care is something we're going into now with adults with Down syndrome, and we have a load of advice and information sharing sessions on that. Wills and trusts, moving on. Bedwetting seems to be tagged on at the end there. It's not associated going along the timeline, but if you have a look on our website, this is just the tip of the iceberg of the information sharing sessions we have. We listen to our families, and if they're telling us there's no information on a certain aspect that they really need in bringing up their children with Down syndrome, we find the expert and we will share the information with our families, and that's working very well. So on our website, you will see these QR codes that you can get information surrounding various aspects of the support that we provide. There's local support groups there, breastfeeding support, weaning, constipation, toilet training, and it's all there, and that's all on our website. We have a health visitor section on our website, which you might not know about, you might want to have a look at. So parental feedback, we as I said, we asked our parents how was their health visiting experience, and this is just some of the feedback we were given. We were given the PADS book in our pack. Our health visitor didn't know about PADS, and I think it would be good for them to know that the Nobody Told Me book is really worth a read as a new parent. We've had really great feedback from our Nobody Told Me book. We've had a lot of toileting issues, and it would have been good for them to know and understand things like putting children on the potty early. I think they thought I was daft at 7 months. We get that a lot, actually, that healthcare professionals can't believe that our families are thinking about toilet training, as early as 7 months, especially if they're sitting. But our Pants for School program really does advocate that, and it is making a difference. It involves quite a lot of commitment from the family, but I think families are not regretting that. Like I said, they're seeing that as a lifeline. I can't actually see all this quote on my screen, but I was thrilled to see that PADS posters in the health, I don't know. So I think it was great that my health visitor knew all about the Down syndrome and what was out there. each visit from her was a real positive experience, and it is making a difference. If you have got that contemporary knowledge and you know where to get the information, it's having a massive positive experience on the families that you come across. So I think I may have whizzed through it a bit too quickly now. We've got time for some questions which would be really good. So just to finish up, if you don't know, we have a closed group for healthcare professionals working with children, working with people with Down syndrome, and that includes students as well. If you know students or you are a student that wants to join that, and on there you'll get information of any new resources that we have, any new research that we've got, being published. You can share your best practice. And we can help each other on those in that closed group actually. So our website is this, and up the top in professionals, you'll see that there's a health visitor professional section. In terms of lunchtime webinars that are coming up, we've got one next week actually from Rosie Haynes, who's our Heart Buddy coordinator, who'll tell you how our Heart Buddy scheme works, and why it works, and more information surrounding that. Followed by the dad's experiences, and then our November one is about cultural perspectives, how we can best support families across different cultures, and our one in December is for paediatricians. So those are our webinars coming up. So if you have any questions, do contact me. That's my email address, or contact our, the charity. And we welcome your feedback. If this webinar has not been useful to you, or I've not covered what you wanted from this webinar, or I've been too quick, any kind of feedback, positive and negative, we do act upon. So do think about giving us your feedback, because we really do value it, and also we act upon it, because we want to make sure that you're not wasting your time at our webinars, and we're giving you information that you find useful.